Hey, this is Doctr Night Class. Go ahead and click like and subscribe below. Hope you enjoy the medical content. The posterior side of the brachial plexus. The posterior side of the brachial plexus. Okay, great. So we have our trunks here, right? We have our lateral aspect of the shoulder, the elbow, the wrist. We have our medial aspect of the wrist, the elbow, the shoulder, which we call the armpit here, medially, the armpit, right? So where's the posterior? On our funny diagram, this funny diagram, it's in the middle, okay? Therefore, respectfully, I put posterior in the middle, okay? In the middle here, all right? So, put it in the middle here, posterior in the middle here. Let's continue. So there is a lesion here at the wrist, right? The wrist. It's on the posterior aspect of the wrist. What will you see? Loss of sensation on the dorsal aspect. Now, this is where the radial nerve innervates. The radial nerve innervates the posterior compartments. That'll be the dorsal aspect of the hand. Be careful, guys. Radial nerve, and then radius deviation. The radius is a bone on the lateral aspect of the forearm. Radial nerve is a nerve in the posterior compartment. I know they're not making it easy for us, right? But you can't give up, okay? You just have to be very specific with the things you say, like median nerve, medial side, right? Just be very careful, be very careful. All right, so damage here about the wrist. On the posterior aspect, you'll have damage to the radial nerve, which gives sensation here on the back of the hand, the dorsal aspect, dorsal, like a dorsal fish with the fin on the back of the dolphin, the dorsal dolphin, right? Okay. If you have damage further upstream, let's say a toddler is walking, they don't walk very well. The mom is holding their hand, and then there's a ladybug on the floor. Ladybugs, they look cool. They're red, they got some cool black dots, right? The baby's curious. It bends down to try to pick it up. The mom says, no, the ladybug's dirty. The mom pulls on the baby's hand. Okay, what happens? There's a dislocation at the level of the elbow. Right here, this is the elbow, a dislocation. It dislocates posteriorly, so it pushes on the nerve in the posterior compartment. Again, that's the radial nerve. And what happens? You'll have a wrist drop. Why do you have a wrist drop? Because we said here, at this level here, right, about the elbow, or between the elbow and the wrist, these muscles, the forearm muscles, what's their responsibility? Their responsibility is to move the hand. Their responsibility is to move the hand. I mean the whole hand. Yeah, like move the hand, deviate it laterally, deviate it medially, right? Maybe extend the hand, okay? So that's the job of the forearm, right? So instead of a deviation, you just have a wrist drop because the posterior compartment or the radial nerve, its responsibility is to extend. Remember, this is flexion, you decrease the angle. This is extension, increase the angle. So the job of the posterior aspect of the forearm is to extend the wrist, okay, so that the hand can move backwards. That can't happen here. So you have a wrist drop. Okay? But not just that, guys. Since it's halfway, right? you're going to have also a presentation, which is loss of sensation on the dorsal aspect of the hand, for both of them. Okay? All right. So the last scenario, this is way upstream. And if a nerve gets damaged upstream towards the spinal cord, a lot of presentation. You're going to have wrist drop. You're going to have loss of sensation on the hand. Oh, yeah, you're going to have a lot going on, right? So here are the two scenarios. Here are the two scenarios. You have a fracture of the humerus bone. Okay, so this is the bone between your bicep and tricep of the upper arm. Why? Because the radial nerve goes in this groove that is mid-shaft. It's in the middle of the humerus bone. We'll talk more about that today. Okay? The other scenario is a patient that's walking around with crutches too long. Okay? With crutches too long, you forgive me. I think I gave that example for here. I was incorrect. Okay? Crutches, you see someone walking around with crutches, it's posterior side. Okay? So it's the scenarios you're going to get in your questions, your vignettes. They're going to describe the patient. They're going to say the patient had a foot injury. However, they're walking around with crutches for so long. Now they have loss of sensation on the entire posterior arm. Click your answer and move on.
So the answer would be radial nerve injury?
Yes, it'd be radial nerve, but if they say it's a fracture of the humerus bone, you need to already think you're going to have an A plus B plus C presentation in the patient. You could even stop reading if you want. Do you have to know they have wrist drop? No, because it's already assumed because the damage is upstream. Do you need to know that they have loss of sensation on the dorsal aspect of their hand? No, because the damage is upstream. It's included. A plus B plus C, right? Included. All right. So does that bring us to a practice question? Yay! All right. Great. Let's go find this practice question. All right. Let's see where I put it. Where are you hiding? You're hiding here. All right. So, gosh, I hope you guys can read this okay.
Okay, off topic, but that dog and baby was so freaking cute.
Oh, yeah, that's my son.
Oh
Yeah.
my god.
And then this is someone's dog, babysitter's dog, I think. Yeah, this is my boy, Luciano. He's the heir to the throne. He's the first one. All right. Don't get me excited. I'll start talking about my kid for like till next Wednesday. All right. So let's do this. I want this guy here. Great. All right. So a 45-year-old woman admitted to the hospital for neck pain. All right, guys, let's stop here. It's neck pain, right? Neck pain. Is it upstream or downstream lesion?
Upstream.
Upstream.
Is it A plus B plus C, or is it just A alone, or just A and B alone?
A plus B plus C.
Beautiful. You see how fast we can go? One sentence. That's it. One sentence. We already know there's going to be A plus B plus B, C situation. Do you believe me? Watch this. Watch this, guys. Watch this. Reveals weakness in the wrist extension, which means that there is damage somewhere here. Okay. Wrist extension. What does wrist extension? Remember I had my wrist up like this, right? Which nerve is this?
Radial.
Radial nerve. So where's the lesion? Off of these two things, where's the lesion? It's proximal. It's way up there. And it's posterior because radial is in the posterior. So where's the damage? Here. Exactly. C is the answer. Look how fast we just did that. You see? Loss of extension, that means that this is damaged. Parasynesthesia, I can never say that word right. This is just sensation. Sensation like the dermatomes, right? To sense loss or weakened on the back of the arm. Arm is the whole thing, right? And the forearm. Again, it's saying that it's affecting a lot of things, okay? It's affecting a lot of things. Look how fast we did that, guys.
Wait, I
This
have a question. Oh, sorry.
is money. This is going to get you so many points. I want you to know everything on this diagram. Everything. Go ahead. What's the question?
Oh, I had a question. How do we know it's the middle part that something's
Very,
wrong, like C7, you know?
very good question. Okay, so you have C5, C6, C7, C8, and T1. Most of the nerves coming from C7, they'll go directly into the posterior division. Okay? Most of them go directly. And that's why I tried to put middle here.
Okay, yeah, I get what you're saying. So why does posterior division matter in terms of middle C7? I'm sorry.
Why does posterior division? Okay, so these are the trunks. So what a trunk is, a nerve has to leave the spinal columns. When the nerve leaves the spinal columns, it meets up with other nerves. When those nerves meet together, it forms a trunk. Okay, so the nerve that left in the C5 region met up with nerves from the C6 region. Together, they form a trunk and produce the anterior division. Okay, now here for simplicity, I just said that the nerves leaving the C7 area in the spine, they all go to the posterior division. Okay? Yes, it's a trunk. It's a trunk, so it's going to have a bunch of nerves going to the posterior division. Okay? Then you have C8 and T1. Those nerves leaving those areas in the spinal column, they're going to meet up and form a trunk, and they'll provide the medial aspect of the anterior division. This is the lower trunk. Okay? So yes, it'd be worth knowing that the middle trunk, that's going to go into your posterior division. Okay?
That makes sense. Thank you so much.
Now here's the confusion here. And it's totally, these concepts, like, they're not hard, they're just heavy. They're heavy, right? They're heavy. So you have to, it's like going to the gym, you know, like to curl 50 pounds, it's not hard. It's not hard to curl a 50-pound dumbbell. You just have to spend time with it and practice using it, right? And then you can do it. But initially, a lot of you guys would probably see this and think, I don't blame anyone. Dermatomes, right? Anyone think that? I think some. I mean, I would think that if I was new to the concept, I'd be like, what the heck are they asking? They're listing these C5, C6, C7. I'm thinking dermatomes, the way that they listed these, you know?
Yeah.
I wouldn't think they're thinking trunks, right? I don't think I think they're dermatomes, right? It's common to think like that. However, we have to use what we know. We really do. I really want you guys take these concept sheets and go fight some questions. Go tackle those NVMe questions. The better you know this, the easier this is going to be. Look how fast we went through that. Wasn't that ridiculous? That was ridiculous, right? And this is actually, this is a hard question. This is a hard question. Go ahead.
The buzzword was back of her arm. That's how you knew posterior.
Yes, but there's other ways. There's other things. Look, wrist extension. That's the radial nerve. The radial nerve is in the posterior. That's also a big thing. Okay, so people are going to read this differently. However, there's so much information that's screaming at you, posterior division. It's screaming posterior compartment. Okay, does everyone know about compartments? Your colleagues at your college, maybe not, but There's no more playing around. We got to figure out a way to organize this so we can do well. Does everyone agree?
Yes.
Okay, all right. Very quickly, right? Very quickly we got through. This is a hard question. A lot of people would miss this. A lot of people.
For more night class content, go ahead and email me at doctrnightclass@gmail.com. That's DOCTR nightclass, gmail.com. Hope you enjoy the content.